Today we're going to be talking about something I've called the back pain diet, which is a common mistake people make when they think about getting out of back pain. Kind of a mindset that I'd like to use an analogy to clear up. My name is Dr. Ryan Peebles. I'm a doctor of physical therapy by profession. I've dedicated the last 20 years of my life to better understanding and reversing the root causes of chronic lower back pain. The problem that I see, and I've seen time and time again, is that people with back pain tend to believe once they have helped themselves or have gotten that help and solved the problem, they can finish this solution. So maybe that's going to physical therapy, maybe it's going to the chiropractor, maybe it's a new device. And so they can use this solution for a period of time, and then once they have gotten the benefits from that solution, they can just go back to their normal life. And I will say that I was guilty of this problem too in my personal journey. So when I was in my search, in my journey for over a decade, I imagined that someday I would find my solution and then I could go back to my normal life. But that's not actually the case. And so we're going to apply the concept of dieting and losing weight to this. So we all know that the diet is a short-term solution. In the long term, it often fails. And that's because people with the goal of losing weight will go on a diet, maybe it will work, and then when they finish the diet and go back to their normal way of eating and lifestyle, they gain the weight right back. And so what we've learned with weight loss is that it's not about a short-term solution, but about a lifestyle change. Whatever that solution is, it has to be a permanent change in order to have permanent results. And so that's the way I want you to think about back pain, is whatever you're going to do, whether it's physical therapy, chiropractic, core balance training, the permanent solution is to make that change permanently. If chiropractic works for you, that's something you're going to want to commit to for the rest of your life. Or physical therapy, I do believe, as a physical therapist by profession, I do believe that the biggest problem with physical therapy as a solution to back pain is that people go for a few weeks, they get better, and then they get discharged, and then the problem returns. I went through that cycle countless times. And so you want to consider that whatever the solution is that you are using, you're making a long-term commitment to that solution. And if that solution is not something that you want to make a long-term commitment to because it's too expensive, or it depends on somebody else putting their hands on you and adjusting you, or some device that you have to hook yourself up to, and you don't want to do that for the rest of your life, then you might want to consider searching for a different solution, a more realistic one that you may even enjoy integrating into your life for the long term. The way that we approach the solution with core balance training is not to depend on exercises to keep us out of pain permanently. It's the ultimate goal is to apply this new relationship to our body, to learn a new relationship and then apply it to everything we do in life, so that we don't have to commit to an exercise routine for the rest of our lives, but instead going to do the thing that you want to do or need to do in your daily life, such as dishes or yard work, or maybe it is going to the gym, but you're doing the routine that you want to do. Or it could even be just an extracurricular activity. Doing that thing in a healthier way is the behavior change that makes the solution a permanent one. And so this is a mindset shift, an actual change to who you are. The change has to happen on the inside, and making external changes to go see somebody or be treated by somebody on a temporary basis does not have the capacity to have a lasting effect unless you continue to do that for the rest of your life. That's my personal belief anyways. So make the change inward, and I believe that with back pain, that has a lot to do with the way that we relate to our bodies, the way we move, and the amount that our core is involved in the movements of our daily life. It doesn't matter what you're doing. And we are using this analogy, the dieting analogy, as kind of a myth that the diet will help people to lose weight so that they can then go back to their normal life as a skinnier person and keep the weight off. And I do want to say that if this is the way that you've thought about back pain and getting out of back pain in the past, that's okay. It's actually normal. That's the way that I thought about it for a long time. And I was searching far and wide for the solution that would fix me, and I could just go back to my normal life and never have to think about back pain again. Getting out of back pain is not a diet. It's actually a lifestyle change. And you actually have to make a behavioral change, a lifestyle change, whether that's to the foods that you eat or the way that you use your body. That is a huge advantage to anyone that can come to that conclusion on their own and early, so you can prepare yourself that whatever solution you're doing, you are committing to whatever the solution is, whether it's core balance training or chiropractic or whatever you believe will help you. I hope you find that help. When you imagine yourself in the future finishing that solution and going back to normal again, I want you to ask yourself, what is normal? A normal life is someone that has to take care of their body and do healthy things and do them in a healthy way to protect their back. That is normal. And I, as someone who's dedicated my life to this and successfully gotten out of back pain, still have to deal with back pain sometimes, depending on how I treat my body. And so I want to set the expectations for you. If it resonated with you, let me know, and subscribe if you haven't already. Just help spread the word that there is a solution to chronic lower back pain. And I believe it's learning a new relationship with your body that you can continue on a permanent basis. And so that's what we try to teach here. I'll see you guys next week. And until next time, get down on the floor and connect to your core. Take care, everyone.